Welcome to our Castell Insurance Medicare Part D tutorial. It is open enrollment, and that means you have been inundated with information, flyers, TV ads, everything of the likes, and you've come to us for some help on how to figure out if you're in the right prescription drug program for the following year. So while we are an independent agent and we do work with many insurance companies, we are required to let you know that we do not offer every plan available in your area. Any information we provide is limited to those plans that we do offer in your area. If you're interested in everything, you can contact Medicare.gov, call 1-800-MEDICARE to get information on all options. That's a new disclaimer that we're required to read, so we've gone through it together, but for many of you guys know, we work with a majority of the plans in our area. Some just don't contract with agents, so we're going to obviously talk to you about how we can best find your needs for prescription drugs each and every year. What we have here, I'm going to shrink myself down and show you the best way that we can help you. Many of you are used to this. We've been doing this for about 3 years. If not, buckle up. In about the next 10 minutes, we'll show you how to review your specific options, go through the plans, go through what's available for you, and even end up purchasing and switching your plan all in less than 10 minutes. So hang tight and we'll go over this. I'm going to shrink myself down and show you our very customized website. If you come to castellinsurance.com, you can access it by this center button here, Clallam Part D, or if you just simply open any web browser, I'm going to go ahead and show myself here. We can go to ClallamPartD.com. By opening Clallam Part D, you'll be able to see our custom drug shopping website. You will know that you are in the right place when you see up in this top corner, you see the name Castell and you see our bridge logo right here. So this is where you're going to come to be able to shop your prescription drug programs each and every year. This is a proprietary site. When you go through the enrollment on Clallam Part D each and every year, not only will you be able to have access to our agency for help, service, any questions throughout the year, you will be tagged through our agency so we can help you. But if you see up here in this right-hand corner, you're able to log in. So just for this quick tutorial, in years past, we haven't always recommended it. We do think it's going to be beneficial for you to help save your information. If you log in and click this login button, obviously many of you won't have a username and password. If you go to create an account, this will help you by showing you username, password, and the main benefit there is a few things. Number one, as we walk through this process and you enter your prescriptions, if you have an account, if you have your username and password saved from prior years, it's going to save those things. Most of you don't change prescriptions on a super frequent basis, so this will allow you to be able to cut down on your time next year during open enrollment, because this is going to be a way of the future that we are able to help provide you advice, counsel, and service throughout the enrollment process. So setting up the account will save you hassle and headache the following year. In this process, there's no exchange of Social Security or Medicare information. This is simply, setting up a username, email, and a password. So very similar to all those things. So once you've gone and done that, the big steps of how we're going to help you shop, show, and see all the different things is by entering your zip code. So most of our clients reside here in sunny Sequim, so we're going to go ahead and enter Sequim zip code, and what you will see is you can definitely see there are 2 counties. Most of us live in Clallam County, but there are those on the east side that do reside in Jefferson. But even if you're over in Seattle, you can enter your zip code here. This is not specific only to Sequim. We've named it Clallam Part D just because that's where we reside, but this site works for anywhere in Washington. So you're able to check this and enter view plans. Now, one beautiful thing about this website when you've set up your account is it will remember everything that you've entered from prior years. So as you can see, you're in the right spot when you're seeing Agent Castell up here. Once you've logged in, it'll probably have your name there. And what you'll see, we are working currently for plans 2023. The best way, this is going to show you all the plans that we're contracted with. Again, a majority of the plans in our county we are set up with. And the best way to get these things customized to you is to actually go through and enter your individual prescriptions. So when you sit down and you're ready to actually go through this process at home, we're going to scroll down to the bottom here where it says Add Preferences. Now, I'm going to forewarn you, when we click this button, There are a lot of preferences that you can add. You don't need to really go through your health or entering your providers, because these factors, this is not what we're shopping for. All that this website that we're being utilized for is for your prescription services. So you can skip the first two. This is how we can get you through this process in likely under 10 minutes. So I'm going to go ahead and enter a few real common prescriptions. Right here on the center tab is where you'll type it in. As you guys know, prescriptions, there are a lot of them, and they're oftentimes tongue twisters. So as you start to type in your prescription, you will see the website actually pre-fills with some of the most common prescriptions. And so in this instance, the three that we're going to enter are a pretty common place for folks once they get in the Medicare bracket. So we're going to enter lisinopril. When you click on it, it's going to pre-fill with what is the most common, most regular dosage. This is something you want to take advantage and really pay attention to, because you may take more or less. And in certain prescriptions, when you get into kind of a more specialized realm, they can be extended release or tablets. And then when you get into other things, you can have ointments versus creams, and those actually have quite a big difference in what you're actually getting covered and the cost of those things. So in this instance, just for practice sake, we're going to go through with the most common. We'll just do the 10 milligram for lisinopril, and we'll add the next two and go through and get kind of our own personal formulary set. So I'm going to say 300 milligrams, 1 per day. We will add that, and go ahead and add a good old statin, because that seems to be part of the course. So as you see here, if you have a mymedicare.gov account, you can connect and have it send it over, but we're going to encourage you, if you set up your account on ClallamPartD.com, and again, you'll always know you're in the right spot, because every step of the way, you'll see that name Castell up top. That means that everything you're doing is being associated with our agency. And again, to refresh you, one of the main benefits, not only is it going to simplify your process next year, once you set up that username and password, you will be viewable from our end of things. So if you go through an enrollment, if you get halfway through, if you do something, we can actually pull you up, because we will have your member ID number, and we're able to actually look you up. So again, one of the main benefits of setting up that account is not only simplicity on your side, it's the service side. It's what you're coming to us for: advice, counsel, did I do it right? That's not going away. This is just a way to simplify your process from home and allow us to continue to service you. So we're going to go ahead and move forward with these three prescriptions. This is kind of a run-of-the-mill formulary for a lot of folks in our area. The next step, this is crucial. It can have quite a big difference on cost. Most people that we talk to, they kind of have an affinity for their pharmacy. Not many people are going to pharmacy hop year to year to year based on trying to save $30 on prescriptions. If that's you, great, more power to you. It's just not something that we've seen as very common. Most people like either the pharmacist or the location, whether it be Costco or Walmart or Walgreens, you name it. A lot of people like the familiarity of what they have. So what you'll see when you've entered our zip code, it's going to geotag and show all of the nearby pharmacies. I'm just going for entertainment purposes. I'm not getting paid, no solicitation, don't care where you go. I'm going to choose Walmart and Walgreens just to show you some different options. So right now we have Walmart and Walgreens selected, and down here it will see both of your pharmacies. So when I continue, now the system's going to go to work. This is where in 15 seconds, 20 seconds, the computerization of formulary review is going to totally out horsepower any human knowledge information that there is. This is what any licensed agent will be able to do for you. They're looking at running your drugs through the computer that does this homework, and it's got the horsepower to run your drugs through in 30 seconds or less. So what we can see here, now the plans are taking into account your prescriptions. So you've entered your 3, and as you can see, green check marks, those are good. That means they are covered. Again, these are all pretty generic plans, so you'll see that these are covered. If you start having really high cost prescriptions, tier 3, tier 4, tier 5, experimental prescriptions, you may see red check marks. That's going to mean that those are not covered by the plan. But ultimately, the work has now been done. And what I mean by that is the website has now categorized and put in order the plan that is best for you based on your prescriptions and your pharmacy. So what you'll notice is The best plan that rose to the top for these 3 prescriptions while going to Walmart was the Humana Walmart value plan. Go figure. That's probably why it's one of the best. It's going to give you the best drug costs. What you will notice, it's not the cheapest. So we do have a plan that we're contracted with that offers it for $11 a month. But what I can draw your attention to that is a very helpful number, and we'll dive into some of these factors here real shortly, is the total annual estimated cost. If you hover over this number here, the $415, is simply saying this is the cost of the premiums, so $30.60 over a year, plus the drug costs. So when you add $360-ish, $365 for premiums, plus estimated drug cost of $48, so simple math says that they're saying each month you're going to pay about $4 a month for all of your drugs, you get to this number. So what you will see is if you kind of scroll down, not all plans are created equal. So based on a low premium, you could pay less per month, but you're going to pay more on the drug costs. So for copays, et cetera, et cetera. And as you scroll down, you'll see that number, as these plans become further down the list, that total estimated cost is going up. So the site generally does it for you. Now, if you're one of those households that maybe goes and fills prescriptions at both, or you don't really care, or you've been at Costco and you've been at Walmart at different times, this is going to be an interesting factor for you. So right now, I chose Walmart as my preferred pharmacy. I don't know the answer to this, but watch what happens when we change it to Walgreens. So everyone follow with me now. Keep your eyes on this. Right now at Walmart, the best plan is Humana Walmart. If I'm a Walgreens faithful, what's the best plan? Look at that. I'm so glad when things work out and actually change for me. This is saying if you prefer Walgreens, well, now look at this. Shoosh, we got a pretty big difference here. Walgreens, with these 3 inexpensive prescriptions, it says that the best plan is the $11 WellCare plan. And it's $133. Let me go back real quick, just so you didn't see the optical illusion. This is, don't blink, you're going to miss it. So if you go to Walgreens, this is saying your best plan is $133. If you go to Walmart, it's $415. So based on these prescriptions, it sure looks like going to Walgreens is a pretty big difference. So again, most of you, if I said, hey, you could save $250 by shifting everything from Walgreens over to Walmart, a lot of people wouldn't do that. They wouldn't change their pharmacist and where they go for prescriptions over that small of an amount, but some people would. So that's why it's always important to kind of look. If you have a preferred, this kind of shows you some of the information. Now, if you really want to drill down and see what we're talking about and how much things cost, if you had more expensive prescriptions, you can go here to plan details, and this will show you breakdown about coverage limits, how much things cost. As you can see, this shows all of the goodies. I'm going to scroll down here a little bit. If you did have copays, how much they would cost. And then what I like to do for most people is go over to this tab here, prescriptions. So again, you've clicked on plan details. Now you're going to go to prescriptions. And this gives you some insight for each prescription that we entered, how much those cost. So on this plan, they're saying these are very inexpensive generic drugs that if you were to just pay cash, you're paying $2 a month anyways. But when you're in the coverage area, you're going to pay nothing. So this is a very quick overview. Many of you have done this. We've been offering this Clallam Part D shopping site since 2019. So for a lot of you, this is not new. If this is new, great. Welcome. We're happy to help show you how to empower yourself to shop your plans. I'm going to pop over to another tab that I have open. What you can do starting October 15th, if you are ready to go, you've fired through entering your account, you've entered your handful of prescriptions, you know that this is the one to go for. If you click add to cart, it will allow you to purchase the plan directly on a secure connection to the website. So what you'll see here is continue to apply. If you click this button, it will direct you to WellCare's website. So I'm going to show you this. We can't do it on the 2023 plans just yet because I'm recording this prior to October 15th, but we can show you what it looks like if we were to do that for a plan from last year. So I'm just for entertainment purposes going to show you what it looks like if we were to purchase a plan going through the whole process. Obviously I can't get you all the way through because I'm not buying a plan for myself, not quite Medicare age yet, but this is the message that you will get. If you continue to apply, you're going to get a pop-up saying, thank you. You are now being redirected to SilverScript or Humana or WellCare or whatever the company. This is just saying you are now leaving Castell and Clallam Part D. So you're going to go ahead and continue. When you go to this new site, it's going to bring up the ability to enroll. As you'll see, this is very slick. This is how you know that you're still on a safe, secure site. It's got all of our information. And you're simply going to go through to enroll, and there'll be a tab on here that says, open enrollment. This is a little help and insight. This is not perfect because the 2023 plans are not available to purchase until when? October 15th. Thank you for the crowd. If you were listening, I appreciate that. But this is just a way for you guys to go through, and what you should know when you purchase a new plan and sign up for 2023, it will automatically cancel your plan from 22. So if you go through things and you're wanting to change, you see a big difference in savings, cost, prescriptions, simply by buying a new plan, you will cancel your old plan. So there's nothing else you need to do. There is physically no way possible to have more than one Medicare prescription drug policy at a time. Now that said, we do know that many people will go through this exercise. It's a good peace of mind and not actually have to change their plan. So something you may want to keep an eye out and really going into this with eyes wide open is to figure out, is there a dollar amount for you that really makes sense that is worth either changing plans, changing pharmacies, all that stuff. A lot of people this time of year, they think that it's an absolute requirement. I got to change. I have to. I've seen Joe Namath on TV. I have to change something. Oftentimes people can be fine in plans for 3, 4, 5 years, but we do thoroughly encourage, go through the exercise. You never know when one of your prescriptions may have moved up a tier or when one of your pharmacies decides to change networks. So these are things that it's always important that we do stress. We think it's a good idea each and every year. As you saw, I took a little bit longer to show you all the tutorials. Takes about 10 minutes per person. So if you're a married couple, you're going to each want to set up your own account, so your own username, your own password. That way it will store your own drugs. It's very common that we have households of 2 that have different plans. Just because you live together doesn't mean you have the same needs when it comes to your medical and prescriptions. So hopefully you found this helpful. If you do have questions, we're not cut out of the loop. As you see, Castell is always going to be at the top of this Clallam Part D website. You still have our agency for help, support, questions, answers, all the different stuff. This is just part of the way that we're able to offer our advice and counsel using new technology. So we appreciate you guys. As always, if you have questions, comments, concerns, reach out to the agency. Our whole Medicare team, the whole team here in Sequim is happy to help. And if you found this helpful and you have other friends and relatives and neighbors that you find are struggling with services that aren't clients of the agency, as you guys know, it would mean the world for us to be able to help more folks in our community feel like they're empowered to do the right thing. So we look forward to helping you guys in the future. Happy open enrollment. We will get through this together and go into 2023 and have an awesome year. And if you do have questions about your Medicare supplement, Medicare Advantage programs, options here in the county and throughout the state, we're more than happy to help you. Have a great day. Enjoy. You got this. And just give us a call if you have any questions.